Welcome, everybody, and thank you so much for joining us today. And we have a number of very important issues to discuss with really top people. We're going to start with Tomer Lotan from Israel, who is the Chief of Staff of the main unit, the main Corona unit that reports directly into the Prime Minister. He was meant to be with us live. And afterwards, we're going to be hearing from Dr. Richard Friedland, followed by, of course, our Minister of Health, Dr. Zweli Mkhize, at around 6 o'clock. Tomer was meant to be with us live, but he was called into an emergency cabinet meeting, a Corona cabinet meeting in Israel by the Prime Minister. And so we had to record this afternoon, and he'll give a perspective from right from the headquarters of what happens in Israel from the response of the Israeli government to Corona. So we're going to now play that recording, and then I'll be talking to Dr. Friedland, and then afterwards to Minister Dr. Zweli Mkhize. Okay, Tomer, welcome. So lovely to have you. And I want to just start by thanking you. I know that you are busy day and night in this fight against Corona in Israel. And so thank you so much for making the time to talk to me and to the community.
Well, thank you. Thank you for the invitation. This is, I think, a great opportunity and honor to speak with you guys, though days are really tough, as you mentioned. Yeah, I think that we can learn much from each other, and this is very important to keep this relations and this discussions on.
Thank you so much. Maybe, Tomer, you could start by just explaining your position in the Israeli government. What exactly is your position, and what are your responsibilities, just to give us a sense of understanding and perspective?
Well, I'm currently the Chief of Staff of what is called Magen Israel, which is the Israeli national headquarters for fighting the corona. This is the kind of a new entity that was formed in last July, more or less when the second wave of disease started here around the summer. And this was the point where the government decided to nominate what we call the national coordinator, or the leading person to lead the fighting against the corona. And currently, this is Professor Nachman Ash. So I'm accompanying his work as Chief of Staff. And basically, our role is, we have two basic missions. One is to be the policy advisors for the government. So we provide the policy work and the recommendations for what should be done. But also we have kind of a operative role in, I would say, building and promoting what we call the defense infrastructures against the corona. This means issues such as the epidemic investigations, the work with the local authorities, the formulation of what we call the Ramzor, the traffic light measures that we use to operate the main the resources of the corona fighting, and also many missions regarding the hospitals and the community work. So we have kind of a very tough policy responsibility, one towards the government and the other for the operative bodies that are, working daily towards the corona defense work.
Okay, that's amazing. And so, do you report in? Does your division report into the Prime Minister or to the Minister of Health, or it's both?
Directly to the Prime Minister. Basically, we're a body. We were an entity that was never formally exist. I mean, look, it's the first time that this kind of entity has been introduced in the Israeli government. So basically, we work directly towards the Prime Minister and very, very closely with the Minister of Health. There's also the Corona Cabinet, which is a cabinet formed from around 12 ministers that work together to take the main decisions of the Corona crisis, and this is where we meet usually. It happens about once a week. So usually we find ourselves in this Corona cabinet or in government cabinet. One of these is going to happen in 3 hours from now. So yeah, we're around we're actually in the middle between the political level and the executive level in the ministries.
I see. And this cabinet meeting, this Corona cabinet meeting, which is happening today, do you feel comfortable to mention what's on the agenda? Is that open for public knowledge? If not, that's okay. I don't want to put you in a difficult position.
Well, basically, the agenda is usually open. I mean, is known to the public. Today, we're going to discuss the reopening or the possibility of reopening the education system, mainly the nurseries, the younger children. After 5 weeks of lockdown here in Israel, we are currently at the point in which we are, I would say, prepared to a certain reopening of some of the economy, some of the education, but we're doing it at a very delicate point in which our disease level are still very, very high. We're here still in what we call the third wave of disease, which is currently very high, but also in a very, very intensive and successful vaccination project that gives us the hope that we can handle this opening on the other hand, and basically trying to hold this stick from both sides. I mean, pushing the vaccination very strongly and holding the disease levels in a kind of an average level. This is our main mission today, and we're doing it in the cabinet. So again, today we're going to discuss education, and in few days from now, we're going to also discuss the reopening of some of the economy, mainly stores and supermarkets and things like that. As you know, this is a very difficult thing to do.
Yeah. No, these are the most difficult decisions imaginable, and I think that what's been so interesting I've found from the approach, the Israeli approach, is as you say, these two dimensions. That on the one hand, the lockdowns. I read somewhere that Israel has had more hard lockdown, almost than any other country in the world, and yet at the same time, vaccination rates, which are the highest in the world by far. And it's sort of these two things together. Maybe if you could just share with us on both. Let's just start with the number of lockdowns and days in lockdown. It must be one of the longest, when one looks back a year from now until now, it's been one of the longest lockdowns in the world. And that has been driven by your unit. Is that right? Your unit within the Prime Minister's office?
Yes. Well, it's pretty much true that Israel has produced more lockdown days than most of other countries. But we have to say that lockdown is a kind of a huge word that is can be translated into very different kind of restrictions. But I think that we've been putting a lot of effort on the education system. One of the reasons is because Israel has, first of all, many children. As you know, we are a very young society, so we have very large numbers of children at schools, and also we have more children in each classroom than many other countries in the world. So the density of classrooms is also one of our concerns. So I think that we in education days, we obviously had more lockdown days than most of the countries in the world. And again, that goes back to the reason I just mentioned. And also we have to remember that I would say that the Israeli compliance levels are not as high as other countries in the world. I mean, we see and we are meeting on a daily basis troubles or problems or challenges of compliance are very different from one sub-society to the other sub-society. As you know, Israel is rich with many groups and subgroups, and this makes the corona handling much more diverse, much more difficult. When you think of issues such as enforcement and issues such as incentives for changing behavior, these are very different between the Arab population and the Orthodox population and the secular population. And I think that in many ways we found these differentiality very challenging to handle. And in few cases, maybe in more cases than other places in the world, that led to a certain point in which we had to have a national lockdown. And we actually have launched it more times than others, I guess. Maybe this is something to do with the way Israel is. I mean, the way our society is built, in our characteristics. I can say on a general kind of understanding that, I mean, and also on a personal level, that we found ourselves many times meeting things that are deeply rooted in the Israeli society, the Israeli governance, the Israeli way of living more than anything else. It's not just about Corona. It's not just about health. It's about how your society is handled. And I think that we've met some of the deep troubles or deep challenges of the Israeli nation. And Corona is like a mirror for those challenges all the time. So lockdowns were one of the tools that we used over time.
Yeah, I think that's so interesting because what I've found is that when it comes to Corona, that it doesn't produce anything new in terms of what's in society. It just accelerates what's already there. It just accentuates and accelerates it. But I think let's talk on the more positive side, this incredible vaccine rollout in Israel, which has really taken the whole world's breath away, just to like really in awe of what has happened, because I mean, the percentages are way beyond any country in the world, United States, United Kingdom, anywhere, one looks. Is that something your department has also been involved in? And maybe you can just tell us a little bit about this, the vaccine rollout. What has led to the incredible success of it, and how is it rolling out? And what are the projections of it?
First of all, it's indeed makes us very proud and happy to see the vaccination project and how quickly and how good it goes. I think that in many ways, one of the major keys of success here were the work of the HMOs, the health maintenance organizations, Kupot HaCholim, which is indeed an Israeli magic, I think. I mean, the way that those units are, or those organizations are deeply rooted in the Israeli community, the fact that we are a small country, and the fact that those Kupot Cholim, those HMOs are working on a very high digital technological platforms. That means that we can quite easily get to every person in Israel. And I think that was one of the reasons that we've made this process so fast. The other thing is, I think that again, going back to the lockdowns and the challenge that we all went through this year, I think many Israelis are tired from the Corona, and they want to see and the vaccinations were kind of like a cure coming, feeling that you can see the light at the end of the tunnel. So on the compliance side to the vaccination, we saw a very high rate of people wanting to come and do that. And as long as those HMOs providing them the option, the opportunity to do it, to do that fast, and how easy and friendly this process is, I think made it successful so far. We obviously pushing that with incentives. We're now working on what we call the green passport or the green tag, which is basically a way to reopen some of the economy, restaurants, hotels, and theaters through some kind of incentives for the people who already got a vaccination. This is a kind of very complex process, both legally and on the operation side, but we're really pushing forward on those incentives because we want to see the young people getting vaccinated. We so far had a great success with people over 50 and over 60, and we now at a point where meeting the response of the young people, I mean, less than 40, less than 30, is becoming a greater challenge for us. But I'm very optimistic. I think that we also see on the past 2 or 3 weeks the effect of the vaccinations in the hospitals, mainly for severe cases in the hospitals. And we also see a drop of the 60 plus people being part of, getting the disease. This also a diagram that drops when you look at the numbers over the past 2 or 3 weeks. And I think this gives people a lot of hope that we can get to a new kind of balance with the corona. Having the opportunity to live alongside with the corona and to reopen some of the things that were closed so far, and still be very careful, but also to have the vaccines as something that balances the picture. As I mentioned at the beginning, this is a very delicate point for policymakers and policy as a general. We have now, our challenge now is to move very, very slowly and very, very carefully in this process of reopen the market, reopen the economy, and through the process of the vaccination. And this is something that is very very difficult to project. They're very difficult to calculate. This is kind of, there are many question marks in the process, but this is exactly what we're trying to do. And as long as we're going to be careful and slow, I think that we're going to pass those months in the optimistic scenario, and I hope that will happen.
And I think I want to thank you for your time, because I think that in a certain sense, Israel, and I think the Prime Minister has even mentioned it, is almost like a laboratory for the whole world. So everyone's watching to see what happens in Israel and how this plays out, because everyone wants to know, how much longer to go in all of this, and what effects will the vaccines have, and as it plays out. And I'm sure that you're looking to complete the vaccination of the vast majority of the population within the next 2 months or so, 2 to 3 months, and then we'll see how this whole year plays out. So there's a lot to look at, of what's going on in Israel.
Well, we do feel like pioneers in this process, and we actually get lots of phone calls and emails from people from all over the world, mainly focusing on the vaccination project and how we do that. But as you mentioned, we're going to the near and far future is not completely clear. We didn't mention the issue of the variants, the mutations that we've came across in the past 2, 3, 4 months, and that also is another factor in the scenarios that may change the course of things, and we also trying to take this into account. But yeah, we feel like we are ahead with kind of the new world meeting the fighting with the corona, and this is obviously brings a lot of responsibility to what we do here at the headquarters and the decisions and for the decision makers. And again, I hope to be successful and optimistic over the coming weeks, and hopefully to make our next conversation in person and not in the Zoom.
Yes, wonderful. I so look forward to that. Tomer, may HaKadosh Baruch Hu bless you in your work, and everyone in Medinat Israel for everything that you're doing, for Pikuach Nefesh, to save lives, mamash, and thank you so much for making the time today. All the best for the deliberations of the cabinet, the Corona cabinet, and may Hashem guide you in everything. Thank you so much.
Thank you so much.
Thank you, everybody, for being with us today. That was recorded earlier this afternoon. Tomer was meant to be with us live today, but he was called into this Corona cabinet meeting by the Prime Minister, and that meeting is taking place now as we are gathering here. So we had to record that just a few hours ago. We have with us live Dr. Richard Friedland, who's really guided our community through this, providing the context and the perspective of the numbers and the trends. And at around 6 o'clock, we'll be joined by the Minister of Health, Dr. Zweli Mkhize. But before the Minister joins us, Richard, if you could give us the perspective in terms of the numbers and where the country is holding at this point.
Thank you very, very much, Chief Rabbi, and incredible insights from Tomer Lotan, which I think we can all learn from. We're in a very different position than we were a couple of weeks ago, and indeed 2 weeks ago when I addressed the community. We are seeing recovery across all provinces, very rapid recovery, which is excellent. And I'm going to show that to you very, very briefly in the 8 or 9 minutes that we have. And then perhaps after our Honourable Minister has spoken, we can talk about some of the issues pertaining to places of worship and concerns around that have been vocalized in the media. I'm just going to share my screen with you. Okay, so very, very briefly, you can see as of last night, this is the same presentation I ordinarily do. We're at 1.4 million cases. The vast majority of cases have recovered. Tragically, we have recorded deaths of 46,000. I think we all recognize that is somewhat understated, but the number of new cases has dropped down dramatically by 3,100 overnight. We're still seeing a large amount of active cases in Kwazulu-Natal, but our belief is that they're probably about 20,000 cases behind in terms of recoveries. In other words, patients who have recovered from COVID, who are 14 days after the initial diagnosis and test, have not been readmitted to hospital, have been discharged and or have not died. And so we think that number is actually lower. I think if you look at the country generally, you can see active cases in all the provinces have come down. And what you can see is this red line here, as I've shown you before, demonstrates where the peak is in each of the provinces. And in every single province, we have more than comfortably passed that peak. And the daily cases, which are very pleasing to see, have all come down and are less than 1,000 in Gauteng, and particularly in KwaZulu-Natal and the Western Cape, where we were most concerned about. So overall, excellent, good news in terms of where we are in terms of the pandemic. Again, comparing ourselves to the peak of the second wave, compared to the first wave and where we are, we've now seen 4 weeks of very significant drops in the number of active cases. And again, you can see we're at the point where we were towards the last week of August. And remembering that we had already opened places of worship during the month of Elul, and it approximates where we are at the moment. Again, looking this at on a 7-day basis, you can see the same diminution in cases. The curve was much steeper and much sharper. And again, that's an area that we are looking at very carefully. Again, looking at the lead indicator, the actual number of cases dropping down very significantly below that of the lag indicator, which is the average over the last few weeks. And it's sitting at 87,000 active cases. If we subtract from that about 20,000 cases we believe haven't been classified as recoveries, you can see we're probably closer to 65 to 67,000 active cases. We're really entering the recovery phase in South Africa. Positivity has also dropped from 34% at its peak down to 10%, still relatively high, but we hope that that will drop. And again, you can see in each of the provinces what's going on. I want to show you the 4 major provinces, week on week, massive declines in the Eastern Cape, and they are entering this week in what we call recovery, just under 100 cases per day. That has lasted longer than the first wave. If you look at it in the Western Cape, again, 4 weeks of drops at about 407 cases. Background COVID was at about 150 cases at the end of September. And you can see that the recovery of the first wave has happened here in the dark brown. And it is really now tracking the first wave. And we look like we're going to be reaching that pretty soon. If you look at KwaZulu-Natal, it has taken longer, but a massive drop in this past week of 51%. Again, looking at it, it certainly lasted longer than the first wave, but it is reaching those levels, which are a lot more comfortable, still at 840 per day, which is a concern. But hopefully in the coming 2 weeks are going to be going into more of a sustained recovery. And then finally, Gauteng, 4 weeks, a very significant drop in cases. And again, the recovery here has actually been faster than the first wave. And you can see it here in dark blue versus the light blue in terms of that. And very, very pleasing to see. We don't know exactly the reason why it's been so precipitous. We're hoping it has something to do with the lockdown. In fact, we're convinced it has something to do with the lockdown across the country, the ban on alcohol, even though that was lifted recently, and certainly the curfew. And so coming to the quintessential reproduction number, how fast is this virus replicating? And as we've always said before, if it's above 1, we're in trouble, and the virus is replicating, we have a pandemic. If it's at 1, it's stable. And if it's below 1, we are in a process of recovery. I'm pleased to say that right across South Africa, it is well below 1. It's now at 0.43. And that is the lowest level it's been at since even the first wave, where the lowest level we reached was 0.45. So overall, very good news in terms of where we are in terms of a second wave. I put this up the last time, and I want to show this to you again in terms of other countries. You can see that they also had a very sharp second wave. France, United Kingdom, Italy, Spain, Portugal, and I just added Israel as well here. But you can see that no sooner had they come out of that second wave, they experienced the third wave. And if you listen to Professor Abdul Karim, his estimation is it may well be in early winter, May, June. Our estimations are around that. It may be even as soon as April. And so it emphasizes for all of us that the non-pharmaceutical measures that we have in place remain absolutely critical for us until we've vaccinated our population and achieved herd immunity. We need to maintain vigilance in that regard. I'll stop there.
Thank you, Dr. Friedland. So appreciate that perspective, and thank God that's wonderful news for our country. As you say, it's not a time for complacency. We need to be vigilant as ever, but we take a moment to be thankful for the good news. I think it's a real blessing.
Absolutely. I think, if I may, I don't know whether our Honourable Minister has joined us yet.
He'll be joining in the next few minutes, but we'll keep talking until he joins. He should be in the next 5 minutes or so.
I think one of the important things to address is this concern about places of worship and whether our communities are adherent to the policies and protocols. And I think the simple answer is that we should be less fixated on location, as we should be fixated on compliance for everyone in South Africa. And whether we're talking about a shul or a place of worship, or a supermarket or a bakery or a place of work, we should all be fastidious about adhering to the protocols that we all know, the non-pharmaceutical protocols, and certainly the regulations that are being now governed by law. And I think that's a very important message for our communities. And call it out. If you're in a community that is not obeying the regulations, that is in breach thereof, perhaps it's time to move on. Or if you're shopping in a shopping center that's not adhering to it, certainly call it out in your place of work. I think that's the message that we want to give. The policies and protocols are firm. They are appropriate. They're based on medical science, and it's up to each and every one of us to comply. What I would say, Chief Rabbi, is of concern, and I've seen it having attended a number of funerals, not just in this community, but in other communities, is that it's often very, very difficult, given the enormous emotional outpouring and grief, and the fact that people are bereft, to maintain social distancing and the wearing of masks at funerals. And I would really urge us to be very, very careful in those circumstances. Often people are very emotional, their masks are wet, or they take their masks off, and as a result, they can spread it. And that and weddings remain for us an area of concern. I see we're joined by our Honourable Minister, so I'll stop there, Chief Rabbi.
Let's just check if the minister is ready to join, because I think the minister is, then we'll welcome the minister. I think it's someone from his office. The minister will be joining in the next few minutes. But if I can just emphasize again what Dr. Friedland is saying. Firstly, I want to also reassure the community, Dr. Friedland and Professor Schoub remain part of our medical panel that is guiding our community, our shuls, in everything that we do. We pay tribute, of course, to Professor Crom and thank him for his very hard and diligent work over a long period of time. I think that the important point that Dr. Friedland is making here is the idea of co-responsibility. You see, I think from the reports I've got since August 2020, when we reopened the shuls, there were a tremendous adherence to it, and that's wonderful. But it's really co-responsibility from each one of us. I do believe the minister is on the line with us, and it's a great honor, Minister Dr. Zweli Mkhize, to welcome you to our Jewish Community Forum here, and to thank you so much for making the time, Minister. I think certainly one of the minister's assistants is on the line, and the minister should be on any minute. As soon as the minister is on, please join in the conversation, and then we'll revert immediately to you, because we know how much pressure you're under. But this point of co-responsibility is crucial, because I think overall the overwhelming number of shuls have been exemplary. But whether it's a shul or a place of work, or it's a shopping mall, whatever it is, co-responsibility is the message for our country at this time. We all need to be part of that solution. If your shul is not adhering to the protocols that we've given them, then raise it with the rabbi, with the shul chairman, be part of the solution. If they're still not listening, then you need to find a safer place to be. But I have no doubt that the shul leadership will respond so warmly to it. We all need to be part of that solution. So I think and this is the point that Dr. Friedland is making here, the idea of co-responsibility. We all share in the solution. We can't outsource our safety and our health to other people. And it's not just about shul, it's about school, it's about work, it's about shopping malls, it's about wherever, a bakery, a butchery, wherever you go, we need to be part of the solution in ensuring that both us and our country remain safe. And we need to assume that responsibility, because we are living with this for the months ahead and for most of this year, and so we need to constantly be part of that solution. The minister will be joining us any moment now. Members of his staff already on the line with us. and we want to express on behalf of our community how grateful we are to the minister for making the time to speak to us today. With bearing in mind all of the heavy responsibilities that he is carrying. So the minister will join us at any moment. Dr. Friedland, is there anything further you would like to add to your comments while we wait for the minister to join us?
I think, Chief Rabbi, you've said it all. It is this issue we've been speaking about for the last 14 months on co-responsibility. Every one of us knows the importance of wearing a mask. Every one of us knows the importance of appropriate social distancing and of appropriate screening and of washing our hands. And so it's behoven on all of us to call that out and hold ourselves responsible and other people in our community. As I said earlier, I think the issue, as I've seen it certainly in the last 2 weeks, is a real concern around funerals because of the enormous emotion and feelings of grief that people feel. It's absolutely natural to be hugging people and kissing people and embracing. And often there is a lot of tears and fluids. And I think that is a concern. And I think we've just got to be very careful at funerals and also at weddings, where conversely there is an enormous amount of joy. And so perhaps a bit of alcohol as well. And as a result thereof, we become lax. And I think those are the two environments that remain great areas of concern, notwithstanding the fact that we have very strict protocols and there are regulations promulgated. But in terms of the message around places of worship, we all know that these protocols have been put out there, they've been tested. We've been through them with all the communities, and it's up to each and every one of us to take that personal responsibility and ensure that they are carried out. And not just there, but at a garage station, in the supermarket, in our places of worship, certainly at sports events, anywhere where there is any public gathering whatsoever. Thank you.
Yeah, I do. Thank you so much, Dr. Friedland, and thank you so much for giving us the perspective on the numbers and sharing that with us and being with us for a year now, guiding our community response. And I think I do want to pay tribute, because I've seen firsthand the hard work our shul committees have put in with their rabbis and chairmen and shul committees and volunteers who've done so much work since August, when our shuls returned. And of course, it is want to pay tribute to them and also to our schools who've done so much hard work, but realizing ultimately this is a question of co-responsibility, that we are all part of it.
And I think if I may say this, Chief Rabbi, two things. Firstly, I want to thank also on our behalf Professor Ephraim Kramer. I think he did this on a completely voluntary basis. He did an enormous amount of work. He visited every shul, and as a result, we have world-class protocols. So really a huge vote of thanks go to him. But I think there's a question being posted here around vaccines and a potential third wave. And I suppose one of the reasons why I put up the slide that I did earlier showing the third wave in some of these European countries is that we need to remain vigilant, even though the numbers are coming down and it looks like we're entering to a recovery. Please God, that recovery will last a long time, but it is entirely dependent on all of our behaviors. As the lockdown ends in the middle of February, as schools go back, as people return to work, it is going to be even more dependent on how we behave and to try prevent a third wave, because it's only until we've got ahead of the virus, we've got a vaccines that work, and we can vaccinate all the peoples of South Africa, then we can potentially begin even then to possibly relax. But we're a far way away from that. And so all of these measures, notwithstanding the fact that we are coming off the second wave very rapidly, are really imploring us to continue with our non-pharmaceutical measures and remain hypervigilant and call out our colleagues who are not doing so. I'll stop there. Thank you.
Yes, and I think you mentioned about world class. I actually got a message from the Jewish agency that supports Jewish communities around the world, and they have found and studied protocols around the world, and they've found ours to be of such a high quality, and the resources that we've offered shuls, that they're asking to use our website and all of the resources and materials which are available. And as you said, Professor Kramer personally inspected more than 70 shuls around the country, put in a tremendous amount of work. I want to thank him for that. But I think as a community, we can be very proud of what we have achieved. And of course, nothing is perfect. And we all need to, it's not a destination or a goal that is reached. It is a process, and we all need to be part of that process and to be part of making it work. So I think that's very clearly the message here, and that we all participate in this in the solution. So I think that's very important. This message of co-responsibility. We all own this problem together, and it's something that I'd want to do. I think what's also important, and I'll just share this with you. It was something I wanted to share at the end of our webinar today, but I'll share it with you now as we wait for the minister to arrive. And that is the importance, and we learn it in this week's Parsha, Mishpatim, which is all about the ethics of how we treat one another, with respect, with decency, with kindness, with compassion. And that becomes all the more so important in the context of a pandemic, when we're all under so much pressure. It's so important that we don't turn against each other, whether it's members of our community or as fellow South Africans or as fellow human beings. That we are there to support and to show compassion and respect to one another. And that's why, it's so significant that this week's Parsha, Mishpatim, is the Parsha, the portion of the week that comes after the giving of the Torah, which we read about in last week's portion. God gives us the Torah and then says that the foundation of this is also the ethics of how we treat one another. And our ethics and kindness and compassion is tested to the limit when we're under pressure. When we feel threatened, that's when we need to dig deep and not turn on one another, and not speak the lashon hara, and not look to blame and to attack one another. We need to of course support one another in it, but we need to do it with respect, with dignity, with kindness, as a community, as a country, as all of humanity. That becomes such an important part of how we respond to this. How we respond is not just about the physical and medical safety, it's also about our moral and spiritual safety. Because if we make ourselves safe medically and physically, but at the same time we turn on one another, then we haven't done it morally and spiritually. And we need to do both. And that's the message of this week's Parsha. Eile HaMishpatim, these are the laws. These are the laws of ethics, decency, kindness, menschlichkeit. That's truly what it means. And so I think that's also a very important part of how we engage with this, and an important part of the response, because the response is not just medical. It needs to be spiritual. It's about the way that we pray to God. It's about our faith in God. It's about our faith in each other. And I think it's that kind of kindness and compassion that is which is so important.
Chief Rabbi, I also want to be able to answer a question that was raised by someone on this chat or Q&A. Was the question of, if you've had COVID, do you still need to wear a mask? Absolutely. There are many variants of COVID, and we're not sure which one you may or may not have had. And as a result, we should all be wearing COVID, to protect ourselves from being reinfected or possibly with a different variant. And we don't have perfect science. And so we cannot afford to say, you don't have to wear a mask, and yes, you do. And so as a rule, we're asking everyone to do so.
Minister, welcome. Minister Dr. Mkhize, welcome. Thank you so much. I'm so grateful for you. Minister, I cannot believe how busy you must be on any day of the week. And of course, today is no exception. And the fact that you've made the time to engage with the Jewish community it means so much to me and to my community. Thank you so much.
Thank you so much, Rabbi. I'm sorry about the delay, but I am here at this point. Thank you.
Okay, great. Minister, I just want to start off by saying that my prayers are with you and with our country, and our community has been praying. And I want to remind you, Minister, I don't know if you recall when we spoke at the start of this crisis at one of the meetings that we had with religious leaders, at the presidential guest house, and the minister, actually, we had a conversation, and it stuck in my mind, where you said it's so important to pray, and then I must take the message back to the synagogues to pray. And so I want to acknowledge you as a man of faith and a man of prayer, and to say we've been praying, and our prayers are with you and our country and our world at this time of such enormous crisis.
Well, thank you very much, Rabbi. Indeed, South Africans are a society that is a faith-based society. And therefore, when things are difficult and we need to ensure that we are able to support each other, when we want to make sure that we build up strength and dig down to get the resilience of our society, we have to actually strengthen their faith-based practices, and at the center of it is prayer. And a number of people, when they are under treatment, on the one side, you've got a physiological or physiochemical response to the medication, but you also need the spiritual aspect so that someone is in a position that they can be treated and they can improve. So we did ask that society should go onto a prayer. That was because at this point, the real challenge we are facing is that there is a whole disruption on the way we know our lives to be because of this COVID-19. But thank you very much for all the support and the prayers. Even as government, we do appreciate.
Okay, of course. And Minister, if we could just begin our discussion today on the subject that's on everybody's mind, which is, of course, the vaccines, which I know there is, for health care workers first, and then, as the President announced, also, for the rest of the population. Are there any updates, Minister, that you can share with us today?
Well, the updates really are that we are on course with our vaccination program. What we have encouraged is that because of the sensitive nature of this program, we needed to all work together. So our program is that government will procure, but the participation is going to be public and private. And we have actually got good support from private sector that we can work together both in the administration of the vaccine, as well as in the issues of logistics and also in the financing of the vaccines. We've spoken to the medical schemes. They will be making a contribution. We've also spoken to business for South Africa and a number of private sector players to come in and play a role. The main issue here is that we'll have a multi-sectoral response. We need every sector, religious, faith-based leadership and communities, workers, the labor, and every sector. We need those leaders to be in the forefront to actually encourage our people to participate in the vaccination program. We need to also make sure that we fight and stop corruption so that we don't end up with a program so big and so important to be actually derailed by such problems of corruption. At this point, we will be announcing later today that we are going on, but we are going through, as I've just got out of here, is a discussion with our scientific community. All our scientists and experts are looking at what vaccines should be available by next week that we will start working with. So that will be a huge a report that's coming out at 7 o'clock with various reports of various trials that will be coming through.
Yes, thank you so much. And I think what you are mentioning here is such an important thing. South Africa is a country of partnerships, and the fact that we all work together as a country, public, private, religious, business, all different sectors of society, and in a sense, we all have to rally in a spirit of unity in order to overcome this this enormous challenge. Unity is everything, isn't it? I mean, it's the heart and soul of the South African dream.
That is correct. That is correct. We need to be united behind the program.
And Minister, I was just thinking to myself, when you're looking back on the last more than a year, the fact that you're Minister of Health at this time of a global pandemic, the greatest health crisis that has hit our world in more than a century. When looking back over the last year and then also looking ahead to the new year, firstly, looking back, what has been the most difficult part of this last year? I mean, you couldn't have imagined when accepting this cabinet post that this is what would be your responsibilities, to be thrown into something of this scale of challenge. What has been the most difficult moment and perhaps the most inspiring moment over the last year, if I may ask?
Well, I must say that the most difficult part is when you have to face up to individuals, whether it's health workers or family members, who have to come to terms with the fact that as a result of this pandemic, it's no longer a theoretical discussion about an illness or a disease somewhere. It's now hit someone in their family. That for me has been one of the most difficult times, when you could see the level of desperation when people lose someone who was well all along until the past few days, and then every day they nest a hope that they will be able to be rejoined by that member of the family, and they are not. And then the biggest challenge being that that happens when someone could not be visited, could not be seen, could not be comforted by their relatives, and even passes in desolation, isolated away from their own families. That for me is one of the most painful things about this pandemic. And of course, the part that's been most inspiring, and that's really what has been driving me as I move around into different parts of the country, is to know that for every person who is sick, who gets admitted into hospital, there are people who are prepared to face the risk to their own lives, who would stand in there between the person and the disease. It's almost like standing in front of a hail of bullets and say, you are not going to hit this person, I'm going to protect this person, even if the bullets hit me. And that's the level of sacrifice. So whenever I had to go out, that's really what has been driving me to say, I need to be able to meet these men and women and say to them, the country appreciates, the country depends on you, keep up the good work. Let us understand that whilst we have you, we feel safe, and those are the people who have saved the country. But at the same time, we are saying, we do understand that it's at a risk to yourselves. Therefore, let's do everything to try and help you and support you. So somebody asked me, oh, but we're here, there's so much COVID there, why do you go there? I said, but I'm just one person going there once and to see the people there. There are people who are there every day who may have a risk of carrying this infection to go and affect their own families. They continue. For them to continue, we need to be very grateful for that kind of commitment. And that for me is the biggest source of inspiration in this whole fight.
And thank you. That's a beautiful answer, Minister. Thank you for sharing that. Looking ahead in the months, let's say if we're trying to prepare ourselves mentally, what does 2021 look like for South Africa? Because I think on the one hand, there's been tremendous blessing. Our infection rates have come all the way down, and that's in a certain sense a tremendous achievement with God's blessings, and we're grateful to God for those blessings. And I think it's tremendous kudos to you and the approach of the government in helping to bring down these infection rates, and of course to all of our fellow South Africans. But what does 2021 look like as we look ahead in the months ahead? How do we mentally prepare? What can we expect in the months ahead?
I think there are three areas we must look at. In the first instance, individual responsibility. We can never remove the importance of each one person doing everything to prevent an infection, protecting themselves from getting the infection. That's our number one ammo. And in that process comes in the whole question of the safety precautions, the masks, the sanitizers, and so on. Then also participating in the vaccine. The second one is exactly the same thing, but is now the fact that it's when we work together collectively as society that we'll be able to defeat the infection, which means we now need to take responsibility for saying to the next person, we're not over with COVID, so wear your mask, wash your hands, sanitize, and take the vaccine. Those two, for me, are most important. But what those two will do, they will give us people who will be saved from the infection, a population that's going to be healthier and safer, and that is the foundation block for a strong, vibrant economy. So our economy should be rebuilt on the basis of ensuring that our people are safe, and out of that, we see a lot of that as a transition that 2021 is going to do to us. Between now and end of the year, we are going to be focusing on accelerating vaccination, but we will not stop the use of masks and sanitation right throughout the whole year. So somebody mustn't say, I've got a vaccination injection, I'm fine. They must still continue to use their masks up until we are over. And when we look back at the numbers are deceiving, Rabbi. We were all happy when we said we're going to level 1, and we saw the numbers were around 2,000. They went down to 1,000. They've shot up to about 20,000 per day after we had actually thought we had conquered. So the virus has got a degree of unpredictability. But what can be predicted is that if we keep on to very strong containment measures and we take the vaccine, the chances of the virus coming up is much lower. There is a risk of a third wave, and therefore we must always know that we must work together to defeat the next wave and also make sure that we are all safe by the time we get to the end of the year.
Minister, thank you so much. Just one last question. I don't want to take too much of your time. I know you've got a big press conference at 7 o'clock and you've got so much going on, and the fact that you've made time for us today is deeply appreciated. Just a sense on a personal level, what does a day look like for the Minister of Health in the middle of a global pandemic, and where do you draw your own personal sense of strength to overcome, the enormous challenges you face on a daily basis?
Well, I'm not sure I can put that separate, different to everybody out there, but I think that each and every one of us have to have the faith that it's through our own work and commitment to serve humanity that we'll be able to save the nation. And therefore, all of us need to go and do whatever we can do that's going to make sure that our country is safe. And we draw our own aspirations from looking on a day-to-day basis in terms of how everybody out there is trying to do their best to create a safer South Africa. And for me, it's a very busy day, meetings after meetings and Zoom, and this time they get much longer. And we have got calls of people who have got challenges in hospitals and so on. I believe that a sense of service on all of us, that we have a responsibility to serve our country and our people, is the best way to serve God.
Yes, I think that's such an important thing, the concept of service. There's a statement in the Talmud where it defines leadership. It says leadership is not power, but service. And I use that quote in paying tribute to the late Minister Jackson Ntembu, who was a person who believed in that. Whenever I would thank him for help with something, he would say to me, "Rabbi, don't thank me, I'm here to serve." And I think that concept of service is something which is so powerful that should be for every one of us, that we live with service.
Thank you very much, and may we convey our condolences to all those who have lost their friends, their loved ones, their family due to COVID-19. And I want to say we must not lose hope. Tomorrow will be a better day, and 2021 should signal a change. And therefore, in the next few years, we'll look back at this and look at it with a sense of triumph, because we would have been able to, overpower a very difficult pandemic. But only if we hold each other's hands and have faith in each other, and as well as ensuring that our South African country, nation remains united. Thank you very much.
Minister, may God bless you in your holy work and service, and may God bless our country. Thank you so much. Our prayers are with you.
Thank you very much, Rabbi, and to the whole community. Thank you.
Thank you. Thank you so much. And so thank you to everybody for joining today and for being part of this discussion where we've had an opportunity to see so many different aspects of this and to draw from what we've just heard from the minister. And it's something which made a big impression on me when I first had discussions with him almost a year ago, the importance of prayer. And that, we in the same way as that our portion this week teaches us not to turn on one another, and that we need to rise to the challenge from a moral and a spiritual point of view. We also learn the importance of prayer and turning to God, Hashem, who's listening to our prayers. And that is part of the way that we make a difference, because God has set up the world in such a way that our prayers make a difference, and He wants to hear our prayers. And that is so important that we continue our davening, and to realize this is not just practical and medical, it is also spiritual and moral. And of course, the practical and the medical is part of it as well. We know that the halakha, that the Torah teaches us that saving life takes priority almost over everything. And it's such an important part of who we are, and it's such a great mitzvah, and it is our responsibility to not only look after our own health and that of our families, but of every human being that we come in contact with. We carry that responsibility. So the response to this crisis is a response which is medical, but it is also moral and spiritual. And may God hear our prayers, and may we live up to our responsibility, our co-responsibility, to make our community, our country, and our world a safer, healthier place. May God bring healing to those who are sick, and may God bring comfort to the mourners who are suffering such loss at this time. God bless you to all. Shavua Tov, a good week, and thank you so much for joining us today.